I thought that I was going there and that it would kill me. I didn't know what we were dealing with. None of us knew quite what we were dealing with at the time. I currently work in an intensive care unit, and I have been working in COVID intensive care units. When we first went to New York this spring, there wasn't enough information. Just like the nation, we did not know enough. There were 5 symptoms at the time. So from moment to moment, you thought you had gotten it and you could possibly be dying. It was like watching a movie, like a Will Smith movie or a Tom Cruise movie, where you get there and there's this huge city and there's nothing there. That's exactly what it was. It was very surreal, very, not confusing. It was just surreal. Like we knew we were on a mission, and that we hoped to God that we were going to be successful in that mission. I just didn't know that it was going to be January and we were still going to be on that mission. But we do have a vaccine. Hallelujah. Every single thing they've said has been true. The surge came for Thanksgiving, then the surge came for Christmas, then the surge, they just kept coming. And then the worst for me was that the virus was politicized. I don't care who you vote for. The virus does not care who you vote for. The divisiveness that has come from a virus, to me, has been disgusting. When you see a virus killing people and then you hear people wanting to argue about it, it wrecked me. And it's going to take some time for me to deal with it, I guess. You can't go back and say, man, going out last night wasn't such a good idea. Not once you have it, and not once you've had it and come home and been like, hey, Dad, and giving him a kiss, and he's got it too. We can't all work in an ICU unit. Like, we all just have to do our part. My mental health is horrible. I mean, to be honest, I'm having to see a doctor. Like I'm looking into doing like the meetings, the therapy meetings on Zoom. I've definitely suffered with depression and a lot of guilt, because I have not been in there like some of these other nurses. I was in there at the beginning, but I haven't been in there the whole entire time like some of them have. So I have a lot of guilt, and I don't know how I'm ever gonna reconcile that. I feel like I let my fellow nurses and healthcare team and like Americans, my fellow human beings, I feel like I let them down because I wasn't there for every single second. But I don't know if I would be here if I would not have taken a step back. The man that bothers me the most, he was not yet intubated, and he was on something called high flow, which is it's a high amount of oxygen coming in, and it basically sprays the virus everywhere. So anytime you walk in those rooms, you feel infected, like you feel like you've gotten infected. He started panicking again, and he knew the intubation tray was set up outside of his room. He knew all of it, and I couldn't calm him down outside the window, and I was off shift. So I had to gown up and get everything back on and go back into the room. And I looked at him and I said, do you know I'm from Texas? You know I'm here from Texas. You know I'm here to help you live. Like, I want to help save your life. Yes, ma'am. Yes, ma'am. And he was the sweetest, sweetest guy. I didn't want him saying yes, ma'am. He was so kind. My girlfriend went in that night. I got a text maybe about 9:30, and she said, "Hey, your guy at 24 died." And that was him. And what had happened was that there were so many people that needed to be intubated at the same time, and we did not have enough resources, which is what is happening now, in multiple places all over the country. And so he had everything he needed. We just simply did not have a doctor that could intubate him. And that is why he died. And so to me, it was like, it's not, there's not malpractice. There's not any of that, but you feel it. There's a moral injury that comes along with doing this type of work, because you're taking care of 4 patients instead of 2 patients. You're not doing everything that you know that you could be doing for these people. You're doing everything you can, but you want to be doing it better, like you would be doing it. It just wasn't possible. One of the saddest things for me was I hadn't seen my dad and my mom in a month, and I was leaving to go to New York, and my dad said he got real emotional, and he told me how proud he was of me. And he's a Vietnam veteran. Like, I'm so proud of him. And he was standing upstairs, and I opened the door, and he couldn't come downstairs. And he wanted to, and I wanted to run upstairs to hug him, and he wanted to hug me. And we both realized at the same time that we couldn't get any closer. That would be, if that was the last time we were going to see each other, that was going to be it. Across the house, saying goodbye, love you, proud of you. That was really heartbreaking. So my grandfather got it in November, and I didn't want him in the hospital. He had dementia, and I knew he would probably pass away from it because of his age, and I didn't want him scared. So I drove up to take care of him. I was with him, and that was one of the hardest things I've ever done. But to watch someone from the very beginning, like talking all the way into where they can't move, breathe, and it's your loved one too, was really rough. I hate to be emotional about it, because I think about my friends and my family that are my friends that are these amazing nurses, like the janitors, the people that are transporting bodies. They are not getting as much of a lot of the nurses are getting a lot of the kudos, but they are doing so much. They're putting their lives on the line too. But I worry about my friends. I don't know that this will ever, I don't know that it'll ever go away from me, but I think that I think I'll be okay. But I know that I'll need to actively work on it. I see so many kind and courteous people that would do anything for you, but they won't wear a mask to don't, like maybe don't wear a mask for me. Maybe I'll make it, but my dad won't. And so if you're going to like go out of your way and open someone's door and, pick up their groceries or do all these sweet things for people, and you're such a I know these people to be such kind-hearted people. Why can't you just put a mask on to show compassion and kindness and say, hey, I don't think I'm sick, but just in case, or just to make you comfortable, you know? And I guess there's a whole list of things that goes with all of those topics, but that's been hard for me to deal with, is watching all these wonderful people act like they don't care about the value of other people's lives.